Hello and welcome. My name is Dennis Nazaroff. I am the Director of Global Policy and Communications at AIDS Healthcare Foundation. I'll be your moderator for today's press conference, which is titled A Global Pandemic Treaty to Deliver Security for Us All. This press conference is organized by the Panel for a Global Public Health Convention. The panel, which was founded in 2020, represents an independent coalition of global leaders working to strengthen the world's ability to prevent, prepare, and respond to infectious disease outbreaks. It is chaired by Dame Barbara Stocking, president of Murray Edwards College, University of Cambridge. And the idea for the panel was inspired by a study titled A Global Public Health Convention for the 21st Century, which was produced by the University of Miami with support from AIDS Healthcare Foundation. This study was recently published in the Lancet Public Health. And if you'd like to view the study or get more information about the panel, please visit www.gphcpanel.org. We would like to thank the National Press Club for making their virtual platform available for this press conference. And now, the topic of our discussion today is Global Pandemics Treaty, and more broadly, what governments and international bodies must do together in the wake of COVID-19 to better prepare for and prevent another pandemic of such magnitude. This conversation is particularly timely as the governing body of the World Health Organization, the World Health Assembly, prepares to meet on May 24th, where government representatives will be discussing what needs to happen to address the ongoing crisis and strengthen global health security for us all for the future. Now, a quick note about the format of the press conference. Our speakers will make short statements, and then we will open the floor to questions. If you would like to submit a question, please email it to secretariat@gphcpanel.org, and we will do our best to answer as many questions as possible during the Q&A. And now I would like to introduce our speakers. First, we have Dame Barbara Stocking. She's chair of the Panel for the Global Public Health Convention. She's also currently serving as the president of Murray Edwards College, University of Cambridge in the UK, and she's the former chief executive of Oxfam Great Britain. In 2015, she was appointed chair of the independent panel of experts to assess WHO's response in the Ebola outbreak. Mr. Lawrence Gostin is a professor of global health law, director of the O'Neill Institute for National Global Health Law at Georgetown University in the United States. He's also an expert in global health law, and he has served on 2 global commissions on the Ebola pandemic in 2015, and he was a senior advisor to the UN Secretary General's Post-Ebola Commission. Ms. Jane Halton is the chair of the board of the Coalition for Epidemic Preparedness Innovation. She's the former secretary of the Department of Finance, Department of Health, and Department of Health and Aging in Australia. Ms. Halton has served in various capacities in global health governance, including as a member and chair of the executive board of the WHO, as president of the World Health Assembly, and chair of the OECD Health Committee. Sadly, we had another speaker for today, Ms. Precious Mitsotso, who is unable to join us due to family bereavement. Our thoughts are with Ms. Mitsotso, and we hope that she'll be able to join us in the future. And with that, I would like to turn the floor over to Dame Barbara Stocking.
Thank you very much, Dennis, and thank you to all of you out there for joining us. Now, you don't need me to say again that COVID-19 has been thoroughly devastating. What it has demonstrated, though, is just, especially in the last few months, just how much we depend on each other across the world. Now, we do know quite a lot as what has worked well and what has not worked well in this pandemic. But the problems that have arisen have been identified repeatedly by panels of experts for the last 15 or 20 years. They warned us that we were not ready for a pandemic, and it's proven to be the case. The fundamental problem is that there is no body which can require countries to take specific action. For example, to be immediately transparent about outbreaks, or to act on WHO's advice at a very early stage, or, of course, to combine in a coordinated global response when a public health emergency of international concern is called. There are, in fact, regulations, the international health regulations, and they do specify some of what should be done in some of those issues. In theory, those regulations are legally binding, but countries simply do not comply in practice. The panel which I chair agrees with other expert groups whose reports are being published that a pandemic treaty, probably a framework convention, is needed. This would allow protocols to be added over time, and it would also allow the heads of states who have signed up to meet regularly to monitor and also to move on. Now, we know that some of the issues are that WHO's own authority and its own processes need strengthening. It also needs more and mandated independent financing. So while we recognise that WHO does need improvement, it should continue to be the global standard setter as pandemics unfold. However, this would still leave a yawning gap. What are the mechanisms to ensure that countries do comply? If a treaty is to make any difference, it must fill this gap, and that will require monitoring and inspection function. This might be an extension of WHO, or preferably a separate body. In either case, it must report to heads of state. The reason, of course, is that a pandemic involves many areas of government, not just health. Economics, of course, education, security, and engagement of the public. Ultimately, these all come together at the heads of state, heads of government level, and they are the ones who have to come to decision. And they also, therefore, must be the ones to sign on the treaty and continue its implementation. Now, it won't be easy to persuade countries to agree to a treaty to comply. There will need to be incentives and possibly disincentives for countries who do not comply. And people are looking at various mechanisms, perhaps through the International Monetary Fund, to do so. There will also need, and we've known this for a long time too, to be financial support for low and some middle-income countries to make sure they are capable of preparedness and response. Now, a draft resolution to set up an intergovernmental body to start work on this treaty was planned to go to the World Health Assembly next week. What we are now hearing, though, is that some countries are not going forward and will block this happening at the World Health Assembly, and suggest that it should be left perhaps till later in the year, perhaps with a UN General Assembly resolution. Now, we are, of course, extremely concerned about this. At the moment, we have a real momentum behind a treaty. And the worry is that if we delay it now, when we all know just how urgent it is, then we may never get a treaty. There are some advantages we recognise in this being signed up to with the UN General Assembly. It would make it beyond health. It would make it very clear that it was at heads of state and government level. But we are very wary about actually delaying this process now. Partly because of, as I've said, the issues that the momentum goes away, but also because we know that there are more than 1 million viruses in animals and birds which may transmit to humans and develop human-to-human transmission. Now, we know what the risks are, but we also know that if we deal with outbreaks very speedily and effectively, we can probably stop the spread of a pandemic or at least reduce it dramatically. Now, the faster that we can get this global agreement, the safer we will be. And the big question, I think, for all of us is, after all we've been through, if we can't deliver this now, when will we ever get a robust pandemic treaty? Thank you, Dennis.
Thank you very much for those insightful and inspiring comments, Barbara. We certainly feel that there is a strong sense of urgency to move forward on this. Next, I would like to turn the floor over to Professor Gostin.
Thank you very much. And thank you, James Stocking, for a really important framing of this issue. I agree with you. After all we've been through for now about 1.5 years, that's devastated the world economically, health-wise, and in every possible corner of the earth. If that doesn't prompt us to change business as usual, I'm not sure what ever would. So if not now, then when? So I am concerned that the United States and other countries may want to delay a discussion of a pandemic treaty and the implementation at the World Health Assembly in a short while of an intergovernmental task force on this issue. Having said that, let me just talk a little bit about what a treaty would, what form it would take, and also what content and enforcement that it would have. We are thinking in terms of a framework convention on pandemic preparedness and response. A framework convention is a standard tool. The World Health Organization itself already has one, which is the Framework Convention on Tobacco Control. And it enables countries to set broad principles and then to make them more and more specific through protocols, as Dame Stocking has already alluded to. At the same time, this treaty could come either from the World Health Assembly, or it could come from the United Nations. The WHO is absolutely indispensable for pandemic preparedness, response, and coordination. But as we've seen with so many outbreaks in the past, and certainly with COVID-19, that this really takes a higher level political heft, and not just health ministers. And so the United Nations itself could be quite an appropriate body to bring forward this treaty at the heads of state level. It would include a number of key characteristics that are really insufficiently or not at all discussed in the international health regulations. One of them was actually primary prevention, that is preventing spread from animals to humans, looking at questions of deforestation, live wet markets, and close interchange between humans and animals. And so rather than only responding once the virus and the outbreak is hit, let's prevent the novel outbreak. Secondly, we want to have robust health systems that are prepared for pandemic response. We need to have global cooperation, and particularly at the scientific and technical level, as we'd like to see now with equitable vaccinations. There needs to be independent verification of state reports. One can recall China's delays in accurately reporting community transmission in Wuhan, and then later the impediments to the WHO origins report, and to have good compliance. That is, we need to have treaties that have teeth, that are not just on paper, but actually have rules that countries abide by going forward. And then finally, I would say, if there was one global narrative that the COVID-19 pandemic has highlighted, it is a global narrative of deep inequity and lack of global cooperation. And I'd like to see that treaty address directly the idea going forward of global solidarity and equitable response to any future outbreak. Thank you very much for the privilege of being with you.
Thank you very much, Professor Gostin, for that excellent outline of what a potential treaty might look like. Next, I would like to turn the floor over to Ms. Jane Halton. Ms. Halton, please.
Good morning, good afternoon, and good evening to all of our participants. And it's a particular pleasure to be able to talk to you about why, for the globe, this is so important. I have heard many people over the last many months describe what we are currently enduring globally as a once-in-a-100-year event. Sadly, that is not the case. We have had a series of warnings over the last 20 years of the potential, which has now been realized in the COVID-19 pandemic. We had the scare of SARS, we had the worry of H5N1, and then we had the actual, although not terribly serious, pandemic so declared of H1N1. Throughout that period, the world worked together, sometimes reluctantly, around existing frameworks to try and find ways, at least in theory, to be prepared. I would have to say that these efforts were sadly not sufficiently far-reaching, nor indeed, I would argue, well-meaning collectively across the world. The consequence is what we are now living with, because notwithstanding these warning signs and the efforts made by some to be prepared, including through IHR negotiations in 2005, we are now in a position where the global cost of this pandemic is profound. And I think we should understand that these costs are economic, they are social, they will have profound implications for generations, the implication for women and for girls in terms of education, the implications for families in terms of the death prematurely of loved members of those families is profound. And the sad thing is, as the independent panel chaired by some very luminary colleagues, the Right Honourable Helen Clark and Ellen Chilleref, has shown us recently, the sad thing is that this was preventable. Not only was it preventable, there was precious time lost in responding to the circumstances we have now found ourselves in. And as they say in their report, and I think it's laudable in this report, that it does not point fingers. It simply says we need to do better as a world, as a globe. And for those like me who watch their media feed of the devastation in India, and like you, I've no doubt you have friends, possibly family, who are suffering that devastation. And for those who've been through these circumstances themselves in Italy, in England, in New York, in places all around the world, I think the citizens of our globe are saying to us, please don't let this happen again. Because whilst this has been awful, the thing we cannot bear the thought of is doing this again. And as Dame Barbara and as Larry have just said to us, there are things we can do, but it takes will, it takes grit, and it will take some difficult conversations, because not only are many of our countries still really suffering as a consequence of this pandemic, but there are many people who will still yet sadly lose their lives. And so whilst we have had the international health regulations, these have not been adequate to actually prevent this kind of event. And so now is the time to have honest conversations about how it is we prevent this happening again. And the inequity that we see, I think, is particularly galling. Now, I'm talking to you from Australia. In our region, there are countries very close to our borders where this is similarly causing devastation, where vaccines are in short supply, where hospital treatment is rare if ever available, and people are dying, preventable deaths. So the question of how we ensure that we manage, as Larry says, not just the environmental challenge, going back up the river, if I can describe it that way, to prevent these things, but how it is we can also agree for transparency, cooperation, collective financing to prevent these things, and then the quick, the rapid, the urgent response to outbreaks wherever they are and however they occur. Those are the things that we need to enshrine in a treaty level document. Now is the time to talk about, without finger pointing, how we work together as a globe, as one humanity, to prevent this happening again. Because regardless of where you are in the world, the cost is personal, it's emotional, it's financial, and you know what? It's political. So we all need to rally around efforts to get leaders to actually endorse a treaty. And as has been said, this is not going to be easy. We have to have a conversation about accountability. We have to have a conversation about financing. And most importantly, we have to have a conversation about speed to act. That is what will prevent this happening again. So thank you for the opportunity to be with you, and I look forward to the discussion.
Thank you very much, Ms. Halton, for painting a compelling picture for why we need to work together on this. And thank you to all of our speakers for their insightful ideas. Before we move on to Q&A, I would like to turn the floor over once again to Dame Barbara Stocking for any final thoughts on what we have just heard.
Well, I hope that from those, the passionate statements that we've all made to you, that you are really persuaded that both a pandemic treaty is absolutely vital and also that it's urgent. We hope that that means that you will take that message out and spread it to other people so that we really do build momentum. And as we've all said, we completely understand that this is not going to be easy, and we do need to keep raising the why all the time. Why do we need this? But also, as I think, as Jane has said very strongly, why we are all in this together in doing it. And we owe this to the people of the world, that we actually change this situation so that we don't live in fear for the future of this happening again. So I look forward to reading and hearing much of your reports on this, and we will keep you informed as this goes along about, you know, what the steps are that are taking place, and of course put out further materials in due course. And we'll be particularly looking to the World Health Assembly to see what happens there in the next week. So back to you, Dennis, then.
Thank you very much, Dame Barbara. Okay, we will now open the floor to questions from the audience. Once again, if you would like to ask our speakers a question, please email it to secretariat@gphcpanel.org. And the first question that we will start with is to any one of our speakers who would like to take it, is what is the danger of losing momentum? I believe it was Barbara who alluded to the importance of this critical time right now before the World Health Assembly. What happens if essentially nothing happens in the next few months until the fall? What are your thoughts on how critical this time right now is?
Shall I start and others can join in? I mean, the critical moment is because we've reached the point where leaders, 26 of them, heads of state, alongside the WHO Director General, signed a public letter saying that a pandemic treaty was really necessary. So we've reached the point where there is some recognition that where we are isn't sustainable if we want a safe world. Now, life always goes on. Other things happen. We still have to deal with the pandemic that we have, and that's not going to be easy in its own right. On the other hand, many other things come in, and people forget quite what it was like. We have history in this. We saw this very much with Ebola. There was an enormous call for action, many of the same things we're talking about now after Ebola. But Ebola was contained, and people went back to their ordinary life and stopped worrying about it, and the momentum dropped away again. So there is urgency on 2 points, and again, I think Jane's made them very clearly. One is the risk that we're at. This could happen to us again any time now. It's not that we've just got COVID. For all we know, it could be months away that we have some other virus. I don't want to frighten people by that, but we really do have to be prepared. So we are putting at risk, the longer time we go on before we can get treaty and the work done on this, the more risk that we're at. And we're also, as I've said, at the risk that people's attention moves on. There are so many international issues to deal with that if we don't move when we've got goodwill behind us, then we may lose it altogether.
And Dennis, can I add to that? We talk in this world of the cycle of panic and neglect. And sadly, that is what we see. We see the height of a crisis where people run around worrying, doing, and then sadly, when the crisis abates, they go back to situation normal and they don't think about the future. Now, the one thing, and I say this with some level of conflict of interest, that came out of the Ebola crisis, as Dame Barbara has indicated, was actually the creation of CEPI, which I have the absolute privilege of being the chair of. And CEPI came about because of the concern that we could not deploy vaccine to assist in that outbreak. And as a consequence, people lost their lives. And so one initiative was the result. Sadly, we did not have the fundamental restructuring of our preparedness arrangements to deal with not only something such as Ebola, but also COVID-19. And I think, therefore, the risk for us is, and sadly, history tells us, that people forget so quickly. It's worth reminding ourselves that we talk so often about the number of people who died in the First and Second World War. We rarely talk about the number of people which outweighed this number who died courtesy of the so-called Spanish flu. So even though there was far more devastation from an infectious disease, that somehow disappears into history, whereas conflict does not. And yet we spend a lot of time talking about and worrying about conflict. We don't spend anywhere near the same amount of time worrying about the challenge, the real threat of an infectious disease. And I think that is our concern. Our concern is that we lose momentum. People go back to their lives. They think, oh, fantastic, finished, all done. And they go back to where they were. And sadly, the threat remains.
You know, and there may be a way to have it both ways because as Barbara and Jane have said, that having the higher level political engagement, particularly at the UN General Assembly, could be a beneficial thing. I would certainly like to see the World Health Assembly pass a resolution in strong support of a pandemic treaty, and either to create an intergovernmental working group to work on it, or to strongly recommend that to the United Nations General Assembly, but simply to let the opportunity pass and the momentum pass, as Jane and Barbara have properly said, is a recipe for inaction. We've seen it over and over and over again as our memories fade and we lurch from panic to complacency.
Thank you very much. The next question we have is for Professor Gostin. Professor Gostin, in your presentation, you alluded to the fact that the treaty needs to have teeth. Could you elaborate a little bit more on that? As you know, with the principle of sovereignty being sort of the keystone of the UN system, it may prove quite challenging to create a treaty that indeed has the kind of teeth and power to overcome the reluctance of countries to sign up to this.
Yes, it's an important caution because countries do insist on their sovereignty. But we would respond in two ways. First, that given all that we've been through, and that we know that we're not safe until everyone's safe, and that this requires global cooperation, this might just be the opportunity and the moment where we can actually get a global consensus around a treaty with teeth. But secondly, having a treaty or the international health regulations or any norm, when people don't follow it, is less than useless. It gives us a false sense of security by stating principles that nobody's going to follow. And so compliance is essential. We can't get around it. And we have to break this tight grip that national sovereignty has on us. We've seen the damage with our free-for-all with PPE, with ventilators now, and oxygen in India, with vaccinations. And so we do need to really have compliance mechanisms that apply equally to everyone, but that are strong. And as Barbara said, if not now, then when?
Thank you very much. Dame Barbara or Ms. Halton, would you like to add anything?
I could just add one bit, that we're not asking for the impossible. There are other areas of life where the issues have been taken so seriously that actually the need for compliance has been accepted. And one of the models that we have been looking at, of course, is around nuclear weapons, where the International Atomic Energy Authority has the sort of mechanisms that might work in this. They certainly need looking at, but they do have the teeth to actually make something happen. We're not suggesting the detail of this, but I'm just making the point that there are issues that we take so seriously that we are prepared to find a way to have that compliance. Nuclear weapons, and to some extent the climate change framework convention, now that we're getting firmer on countries having to show really quite clearly whether they are meeting what they have signed up to do. So these are big global problems, and what we're saying very strongly is this is one of them, and it has to be attended to in that way as well.
And if I can add, I think it's important not to focus singularly on the punitive, but also to focus on the positive. I mean, what we're talking about here is an opportunity to secure health for the world, and for no country can they necessarily guarantee, unless they are party to this kind of arrangement, that their population will survive unscathed while others suffer. And so I think thinking about not just the teeth, but also the encouragement component of this is absolutely material to success. We shouldn't be on about finger pointing and vilification. We should be also about encouragement and facilitation. Some countries struggle with technical capability. Well, I think it's time that we assisted. Some countries struggle with the simple financial resources. I think it's incumbent on the world to think about how we manage that as well. Let's make the most positive opportunity for compliance, as well as, we hope never needed, the potential for teeth, in order to get a global consensus about what and how we will tackle this problem with.
Thank you very much for responding to that question. Next question we have from the audience is perhaps once again to Professor Gostin, but of course anyone else is welcome to respond as well. The question is, how will the new treaty relate to the IHR? In other words, would it supersede it? Would it complement it, or somehow in other ways integrate its provisions?
Yes, it's a very good question. In our view, we absolutely do not want this new treaty to eviscerate or do an end run around the international health regulations. What we want the new treaty to do is two things, three actually. One is we want the new treaty to reinforce the norms of the international health regulations. Two, we want the new treaty to fill in major gaps in the international health regulations, which, for example, don't discuss anything at all about zoonosis and don't discuss issues concerning equity. And then thirdly, we would like the new treaty to have incentives and compliance mechanisms, incentives, disincentives, compliance mechanisms over and above those of the international health regulations. And those, I think, would be the three critical differences, so that you now have layers of protections and norms that include the IHR, but go much further with a new pandemic treaty.
Very much. The next question we have is, how do you execute independence in monitoring of compliance? Because if you are calling for compliance mechanisms, that will need to come hand in hand with independence in monitoring.
Shall I have a go at that one?
Yes, please.
Sure,
To
please.
start with, I think what we're saying is that, first of all, like the OHR, but also thinking about WHO more generally, we already have a body that can put forward a lot of what needs to be done. Some of it's already specified in IHR, etc. But also WHO needs to be precise about what is needed. For example, when they make an early warning about a pandemic coming and so on. So we've got an enormous amount of expertise actually that we can apply to this to start with. But as you say, you then have to think about how a body can go beyond that to have the independence that they can work as both the positive, encouraging and but also challenging side of compliance. And I think what we're looking at is something that is, as we said, a bit either above or at least somewhat separate from WHO, even if somehow attached to it, that is a body that is set up independently, and it would have to be set up by the heads of state and government who sign along to this treaty, that it will be independent. And you can set the rules of the game so that the body itself has a lot of independence and doesn't feel beholden to every member state to move in a particular direction. As I say, we've seen it in some other areas. So it ought to be possible for us to find a way to have that sort of body with the technical support of WHO and all its knowledge base behind it, but separate from it, so that it can have the independence to really look at individual countries and to have the right to speak out about what is there, not to be blaming necessarily, but so that we have an open conversation about what is happening and what needs to happen across the world. So that would be my sense of where it sits, but I don't know whether the others would like to add on to that. I think Jane would here.
Yeah, thank you. Look, it's such an important question, and I do think it's going to require perhaps a breaking of the mold in terms of what's required. Now, there's some very interesting recommendations in the independent panel's report in respect of the terms that people might serve, as in only one term. In other words, then you're not attempting to be re-elected for something, and whether or not you could find an approach that would generate experts who might be members of such a panel. In other words, attempting to bring the science and a dispassionate analysis of preparedness, together with a capacity to recommend support and the underwriting for many countries who will struggle financially and in terms of the capacity to organise some things which would be part of a properly prepared environment. So I think we do need to have a conversation about this. And as Dame Barbara says, this is not an easy discussion, but a level of objectivity, preferably an absence of politics, the capacity to mobilise resource to help countries who might struggle. And then I think a genuine consensus around the world that this needs doing, because as has already been said, we're all in this pandemic for once. This is something that impacts every single country. And even those countries who are currently well vaccinated, and there are some, they are by definition affected by the economic chaos, the loss of life, and the genuine disruption that surrounds them, even if their current circumstance is perhaps not as dire. So I do think it's that focus which should enable us to come up with something which is no doubt going to be unique.
Much for that response. Okay, we have a couple more questions that have come in. One is, it says, during COVID-19, every country had its own response with various different measures, and in some countries, even within the countries, different states like in the United States, had their own responses, leading to just a patchwork of various outcomes. And we're seeing that play out right now, in places like the United States, and then, by contrast, India and Brazil and so on. So the world is very fragmented. With the treaty in place, what would the ideal response would look like? I guess what this question is getting on in terms of international cooperation with, things like vaccine access and PPE and things like that.
Mm-hmm. Did you want me to go first, Barbara, or would you like to?
No, fine.
Okay. Yeah. First of all, we're never going to see or even want full national uniformity. We do want different countries to have certain discretion to deal with their local outbreaks the way that they can, but we do want WHO and the international community to set certain minimum standards, because it affects what one country does affects the life of all countries. Secondly, I think that we've witnessed a deeply disturbing, if not unconscionable, amount of my nation first and lack of global cooperation and global solidarity, as Jane, I thought said so well in her statement earlier on. And so a new treaty would really have to boost things like sharing of data and scientific samples and genomic sequencing data. It would have to ensure more uniformity in equitable distribution of medical resources like PPE, ventilators, testing and diagnostic equipment, and most importantly, vaccines. We can't see the same kind of fragmentation and chaos that we've seen during COVID-19. We can do better. We can do a whole lot better if we share resources and we share knowledge, and that is the goal of our treaty.
Can I add to that? I think what we need to come back to is that we know quite a lot about how you do public health surveillance and the sorts of public health measures that are needed as you go through to an outbreak and onto a worse situation. I mean, in particular, things like test, trace, and isolate. They're well known in the public health profession as the things that you actually do when you get an outbreak. Now, what's happened with COVID is it almost feels like everybody has been trying to make up the way to do things in different ways across the world. And we do already know quite a lot. But of course, as Larry says, there's also going to be differences. The pandemics are going to be slightly different. And therefore, people will need good authoritative advice coming from the WHO level about how they handle this one in these particular ways. But they will also have, as always, the need to look at their own communities and see exactly how that does play out there. So you do, but we have more knowledge about how to do this than you would think in looking around about the way we've handled COVID. The best knowledge in public health has not been followed in the way many countries have gone about this at all. I think we have another problem that needs to be overcome here, which I'm personally very, very interested in. And that's the whole phenomenon of leaders wanting to wait and see. And that's a matter of real cultural understanding about pandemics, about epidemiology, about the fact of the rate at which pandemics move, and therefore the difficulties in the whole more traditional way of operating, which is waiting and seeing. You simply can't do that with these sorts of infectious diseases that transmit so fast. They're exponential growth. So there are things that we know that we need to build into this system of response, or preparedness and response in any case, that are well-known things. But as I say, they weren't followed through in COVID, but there will, each time there's a pandemic, there will be different needs to have authoritative statements about what is the right way of handling things. And that's where we're really working to see if they cannot be shared across the world, so we get much faster results during these times when we are really trying to hold outbreaks back and stop a pandemic forming.
And can I endorse both of those comments? And can I just add a couple of thoughts? The truth of the matter is the delay is death in this context is very real. And I do think, and it's well known in public health circles, and we all kind of laugh in a slightly gallows humor kind of way when we say, well, if we overdo it and nothing happens, people say, well, that was all wasted effort. Why did you bother? And if you don't move fast enough and there is a disaster, people say you didn't move fast enough and you didn't spend enough money. So it's a paradox. But we do, I think, know from this pandemic, and again, the report recently released makes this point, that February of last year was a wasted opportunity. And I gave my first interview at the beginning of February. I had just come back from my usual month in the United States in January, and I had literally just arrived back into a scorching summer in Australia, and I gave an interview where I talked about the genuine risk of vaccine nationalism, of the challenge that we would face with people hoarding supplies. And at this point, there were a handful of cases. And I'd remind people that at CEPI, we put our first funding out for COVID vaccines on the 20th of January when there were less than 600 diagnosed cases, because we anticipated this problem. And I think that is the point. We know from a scientific, from a behavioural, and from a financing perspective, what actually we should do now to be prepared. And I think if we can think about how we deploy those resources, how we prepare, and how we actually ensure that we have stockpiles, how it is we have the capability to move quickly, that will make a significant difference. And most importantly, understanding that delay is death, and I mean that very genuinely.
Much. Next question is, it's disguised as a short and simple question, but I think the nature of it's quite complex. It says, what would you like to see come out of the WHA?
I mean, we would like to see, I mean, we had been hoping and planning for a resolution out of the World Health Assembly supporting a pandemic treaty and creating a mechanism like an intergovernmental working group to begin building the building blocks of such a treaty. We think that's justified and it meets the moment of this unprecedented pandemic. But at the very least, I would certainly like to see the World Health Assembly strongly endorse a pandemic treaty and create a pathway for it to happen, if not at the WHO level, then calling on the United Nations to take this up in its fall meeting. I think that's critically important. We can't let the momentum slide, as Barbara and Jane have so aptly explained.
And can I just add some words to that? I think what we want to see is some words that are often used around this, that what a treaty would do would be about transparency, about accountability, and would recognise that you need compliance measures. And if we could start from that point, that obviously needs to go a long way towards from there to a treaty. But if we could start by an understanding that that's what we're really trying to get to, that would be a great start out. Whether it's a working group now or it has to be later, that would be a great start out to getting the treaty that is robust enough for what we're talking about. Jane, I think.
From my perspective, I would like to see a global commitment to make sure that this never happens again. I think it is that simple. And the mechanism through something like a treaty, but more importantly, well, as importantly, a commitment to work collaboratively, to resource that effort, and then to implement what is the best advice about how to make sure this never happens again is what we want to see.
Thank you very much for those responses. And I think we just have one more question left, and then we'll move to some final comments and then to close. So this question says, this is on the topic of zoonosis. So while it's important to prevent transmission of zoonotic diseases from animals to humans, these diseases are a condition of life. So there shouldn't be shame in discovering an outbreak. But sometimes I think there is sort of an instinctive desire by certain states to, hide it or not be as upfront about it. So how can we encourage the adoption of the understanding that this is just essentially, a part of nature?
Yeah.
So I might go first on this
Jay.
one, if
Yeah,
that's all right.
Yeah.
Thank you. So zoonosis is absolutely a function of the environment in which we live, the proximity between animals and humans. But the first thing to understand is it's not inevitable. We know what we can do to prevent these kinds of events. And then in the event that they do occur, we also know what it is that we can do to detect, ring fence and bring quickly to an end these events as well. So whilst I completely endorse the sentiment that zoonotic events can and will continue, and in fact we expect their number to increase as we know, as global populations increase, as the proximity from humans to animals in wild spaces, but also some, as we know, agricultural and market-related practices mean that there is increased risk. But I think what we should say to ourselves is, if we adopt a One Health approach across our health systems and across our agriculture systems, we can significantly mitigate that risk. So yes, zoonosis, we understand it as a process. It will happen, but we can reduce that risk, and that's what we should all focus on.
And just on a more political end, a minor point really, but important, people don't declare outbreaks because they're afraid of what everybody else will do to them as a result. In trade, in travel and all sorts of ways. And I think for everybody to understand that we are all in this together, and therefore to be very responsible in the ways they act towards other countries, including in this case those who've got outbreaks, then we would begin to build up some confidence that you can say that we've got an outbreak, because you'll get help and support, and you won't just get the world closed down on you. And that's really quite important in its own right, I think.
Yeah, I was going to say that, Barbara. That's a really important point that you just made. Historically, governments have delayed transparent reporting because they feared recriminations through trade sanctions or tourism or travel bans. And so we need to make a safe, secure place for governments to report where they're not going to be feeling that they're being harmed. At the same time, one of the things we've seen is the politicization of the pandemic, and it was particularly unseemly during the Trump administration to see the World Health Organization getting caught in the middle of a struggle between two superpowers about who's at fault and where and where the virus originated. It's right, natural zoonoses are no country's particular fault. We need to see this in terms of scientific and public health solutions, and sharing of data, sharing of real-time information, and not blaming one another. And the blaming of one another is not just harmful to WHO and to the global response. We also see that it scapegoats individuals and it causes violence even and discrimination, in this case in the United States and in other countries against people of Asian descent. And we've seen that throughout history, the scapegoating, the other, or the migrant or the immigrant. That's inexcusable, and we have to put a stop to it.
Thank you very much for those excellent responses to really the entire Q&A section. So it looks like we have exhausted our questions. So we'd like to invite you, just each of you, for the final closing thoughts, perhaps 30 seconds, anything you'd like to say in closing. So perhaps Ms. Halton, if you could start.
Thank you. And I hope that this has convinced people that the time to focus on the future is now. There will be no more important point in the history of this pandemic than right now, when the opportunity presents itself in our multilateral fora, the World Health Assembly and ultimately the General Assembly, to actually focus on how the world can come together. This will be a difficult conversation, but it will not be as difficult as the circumstances we have found ourselves in for the last year and a bit. We should think about the people whose lives have been lost. We should think about the healthcare workers who are working around the clock to save lives. We should not scapegoat, but we should say now is the time to come together to bring these sorts of events to an end. And we can do that with a treaty. And so we would strongly, strongly encourage all of you to support that action.
Thank you very much, Ms. Halton. Next, I would like to turn to Professor Gostin for final
Yes,
thoughts.
I thought Jane said it so eloquently. You've heard from leaders with deep experience in global health and global health preparedness from around the world, and Precious were here. She would bring the African perspective. That this is the time for us to act. We owe it to ourselves, and we owe it to our friends and our fellow human beings around the world. We owe it to those who are experiencing it in India and the Indian subcontinent. We owe it to those where it may go next, for example, to Syria or to sub-Saharan Africa. We cannot go through this again with all of the human suffering, all of the economic devastation, all of the children losing educational opportunities, all of the women experiencing violence. This is just simply unacceptable. And we have to remember that we're suffering not just from COVID-19, but it's also spin-offs, food insecurity, educational deficits, childhood vaccinations, injuries, all of the things that really are important to our well-being have been devastated. The whole United Nations Sustainable Development Goals have been set back. And so we absolutely have the power to do something about it. We just need the political will.
Thank you very much, Professor Gostin. And finally, the chair of the panel for Global Public Health Convention, Dame Barbara, your final thoughts.
Well, I think Larry and Jane have made fantastic arguments about what is needed. I'd just ask you all out there to stay with us. We've got a story that's going to unfold in this year. As we go through the assembly, as we get even through the meetings like G7 and G20 and up to the UN and so on. And we really need your help and support in keeping this issue absolutely on the agenda and not letting it roll off again, as we've seen in so many times in the past. It is incredibly important, it's incredibly urgent, and the more you can do to help us would be absolutely great. And thank you to you all for being here with us today.
Thank you very much. And once again, if you would like to stay in touch with us and get more information about the work of the Panel for Global Public Health Convention, please visit gphcpanel.org. And also, if you think of other questions that you didn't get a chance to ask, please email them to secretariat@gphcpanel.org. Thank you very much and have a good day.
Thank you.